welcome to the Vigilate Dialogues. I am your host this evening, Shaina Smith. As always, welcoming you to the National Boardroom. If this is the first time you're seeing the program, the objective of our program is to talk about current community affairs and issues and not just complain about the problems, but to speak about solutions. The last time we were in the boardroom, we actually turned it into the situation room, and we were talking about immigration, labor, and social development here in the Virgin Islands, and we had a very stimulating discussion. So much so that we're going to have part 2 coming up next month. I would like to thank my guests, Edgewenka and Sam Henry, for being here as the panel, and I'd also like to thank the callers that called in and contributed to our conversation. The next situation room is going to be on July 5th, so save the date, July 5th at 9 p.m. right here on Channel 51, CBN TV. We're going to take a quick break from our sponsors, Clover's Shoe Store, and be right back. Welcome back. You're tuned in to the Vigilate Dialogues. This evening, our conversation is going to be about environmental health. And my guest this evening is the Chief Environmental Health Officer, Mr. Carnel Smith. Mr. Smith, welcome to the National Boardroom.
Thank you for having me, Ms. Smith. It's a pleasure to be here. And good night to our viewers.
Okay. Now, environmental health. Persons may have heard references to it. And sometimes we think about public health, or we hear the term public health used. But exactly what is environmental health?
Well, environmental health, it is a branch of public health. And that is concerned with all the aspects of public health, which is focused on the natural and built environment that can affect human health. It is targeted towards preventative measures, so as to prevent disease and create and promote health supportive environments.
Okay, so it's not just about going around spraying for mosquitoes, because that's, for me growing up, before I really started to understand, when I started working with government, really to start to understand what the mandate of that department is. So what exactly are the objectives of the department?
Well, the objective of the department is to develop a set of programs targeted towards health preservation and to prevent disease and to look at all the areas. So it's multidisciplinary.
Okay.
And to look at all the areas where one health can be affected, whether directly or indirectly.
Okay.
And look at those areas and see what intervention there should be in order to help sustain a healthy life and a healthy environment.
Okay, so you guys are kind of like safety police, so to speak, in certain areas, and we're going to get into that. I had a very interesting discussion with him for like about an hour when we were first preparing for the show, and I was like, wow, I could go and change careers and go into environmental health, because it was amazing when you started explaining the different disciplinary areas, because again, some people might just know the division for food safety or dealing with things like waste disposal and those types of areas. So knowing that, what the legislations, are there any specific legislations that that is part of your mandate as far as enforcement?
There are quite a few.
Okay.
But there's still a lot more that needs to be developed. Right now we worked with legislation such as our food hygiene regulations,
Okay.
which is dated back to 1972.
Oh, wow.
And we work with the nuisance regulations, which goes back to 1977.
So what does nuisance regulation deal with?
Nuisance regulations deals with any nuisance that may affect your health directly or indirectly. For instance, it might be the discharge of liquid waste in a manner which may pose a health threat to some persons or a person. It deals with odor.
Okay.
So it's a very wide piece of legislation.
Okay.
But just to say that the legislation that we currently enforce, as you heard, the years that
they
need modernization, they need teeth,
Yeah.
Because the fines are very small and the structure needs to be changed in terms of the way you enforce the regulations.
Okay.
Because for every offense, you may have to go to court.
Okay.
And in these modern times, you don't want to tie up the court's time
Yeah.
in every little offense. So you need to have some ticketing and so forth
Okay.
in order to
By the officers.
move along.
Okay.
If you don't want to pay the ticket like a seatbelt offense, then you go to court.
Okay.
But once you commit an offense, there should be that option.
Okay. So as far as modernizing how those are enforced.
And we're working on that.
Okay. So we have food hygiene, nuisance, and what?
We have mosquito control
Okay.
regulations. Then we had, for a very long time, we had the Quarantine Act.
Okay.
And under the Quarantine Act, you would have things like the ship regulations and the aircraft regulations. But we were never functioning, we were never enforcing those regulations because there were no programs developed for the enforcement of those regulations. But we will get into that a little bit later.
Okay. So just by definition, what is quarantine? So if somebody hears that, a plane was quarantined or a boat was quarantined, what happens?
Well, you quarantine a boat, a ship, or even a person.
Okay.
If they pose a disease threat to the community, the country, a person,
Okay.
you put them in quarantine so as to make sure that there is no contact, or the contact with that person is limited to those persons who are protected against the infectious disease that that person might be capable of spreading.
Okay. So do we have special quarantine facilities? This might be a little sidebar, but do we have quarantine facilities here specifically for that, or would that be something that has to be set up?
That is something that is being currently worked on. I know, for instance, if you go to the hospital, then there might be a room where if you have an infectious disease or some disease of an infectious nature which can be spread, then you can be isolated.
Okay.
But in the broader sense, if you're looking at where if we have a number of people which might pose a threat to your community, say for instance from a cruise ship.
Like when we had this swine flu threat.
Then you had H1N1, where people would travel from one country to another and pose a threat to the community. In terms of isolating people, then you must have a plan with respect to how you will go about dealing with such mass events.
Okay.
And that is something that is being currently worked on with a number of different agencies who would play a role in such events.
Responding to such an event.
Yes.
Okay. All right. So Quarantine Act, are there any others?
Well, there are those who are, there are others like the House Refuse Act. But those are also old regulations where there was a time when solid waste was a part of environmental health.
Okay.
And all those regulations were, so now all those need to be looked at, revised, reviewed, and then make a decision on how to enforce those those regulations.
Okay. How many staff do you have in your division?
When you say staff, do you mean the professional staff? Or because we have our staff can be divided in a number of categories. We have the administrative staff.
Okay.
And then we have those that deals with vector control. And then we have those who are trained in environmental health.
Okay.
Currently, we have at least 5 environmental health officers who would take care of environmental health issues throughout the territory, which I think is just a drop in the bucket.
Okay.
Then we would have at least 10 persons working in vector control. They are the ones who go around inspecting premises and treating premises for mosquito breeding.
So they're the ones that come and tell us we need to take up all those containers and turn them right side up so they don't catch water, basically.
Yes.
Okay.
Yes. And then we would have a few trainees, environmental health officer trainees. Those are the junior staff who get some exposure through working in the division and is being prepared to go off for professional training in the area of environmental health. And then we'll have the administrative staff.
Okay. So when we look at the territory, which is basically the responsibility of the division, that's a very small staffing complement to cover all of that.
Precisely.
Okay, so you guys are very busy.
Too busy.
Too busy. So a typical day in environmental health looks like what? As far as what the inspectors do?
Well, the department is structured in a way that the officers should never have a board day. The territory is divided into districts, and an officer is placed in a district, and that officer would have to carry out all the environmental health activities under the various programs related to that district.
Okay.
And there are a variety. The programs that we are currently operating includes food hygiene, which means in food hygiene we go and we inspect restaurants, all food businesses, which supermarkets,
including the food vans as well.
Supermarkets, all eateries.
Okay.
And then you also have in the districts daycare, preschools, clinics, hospitals, water bottling plants.
Okay.
So we have the food safety program, we have the institutional hygiene and recreational hygiene program.
Okay.
We have water quality, and we also have the vector control.
Okay.
An aspect of it, we have general environmental health, where you would also look at things like designs and construction of septic tanks.
Okay.
So it's quite a handful.
Yeah, that's a busy day.
Quite a busy
a
day.
full 8 hours. If you've just tuned in, you're tuned in to the Vigilate Dialogues. I am Shaina Smith, your host, and our guest this evening in the National Boardroom is Mr. Carnel Smith, the Chief Environmental Health Officer. If you have a question for him, you can call us here on the show at 494-7815, 494-7815. So I'm guessing you guys might be also busy following up on complaints, like persons can call into the department, maybe say with a situation that they have a nuisance. I remember having a nuisance and calling environmental health. So is there a formal process for that, or do persons just call?
Yes, we have a formal process. There's a nuisance complaint form.
Okay.
And when an individual call and make a complaint, the complaint is registered and it is given to the officer, the appropriate officer for that particular area.
Okay.
And then they would go and do the necessary investigations. The difficulty is that not all complaints you can verify. And some people might get a bit antsy or frustrated,
yeah.
If you want to use that term, when they feel that nothing is happening. But sometimes it takes a long process because we have to make numerous visits to ensure
to see the nuisance.
Because remember, when you make a complaint and we decide to launch the investigation, we must verify and confirm that the nuisance exists.
Okay.
And once we verify and confirm that the nuisance exists, then we have a legal process to follow.
Okay.
Because if we don't follow that legal process and it ends up in court, we don't have a case.
Okay.
So we must follow that due process and then make the necessary investigation. Then we must approach the offender and see if we get any compliance. If there is no compliance, then we have to proceed to court.
Okay.
And sometimes that could take months. I've seen it take over a year.
Wow. Okay. So you're asking everybody to be good citizens and be considerate or neighbors, basically.
As Chief Environmental Health Officer, I don't think that all the cases need to take that long, but I understand the reasons because sometimes the judicial system also is under stress.
It's overwhelmed, yeah.
Yes, so I understand that, but the person who is on the other end, who is experiencing the problem, then you also have to understand your frustration.
Yeah. So, but usually in most cases, when you say approach the person, is it more or less quickly resolved, or is it something that, you know, it does have to go to that extreme of going to court?
Usually, we really don't get that much compliance.
Okay.
So many things might have to proceed
Okay.
to court. And as I said, sometimes you may have a backlog of stuff that needs to be dealt with.
Okay. I'm curious though, in terms of, is it the non-compliance due to people not knowing the law, basically ignorance to the law, or is it we know the law but then we ignore it? Which to me is the same ignorance, but still.
Well, once you are approached on a matter, and we would approach you on what the problem is and give you some directions as to how to go about solving the problem. Then there comes the other problem where it might cost money, and the person might not have the finances to do so.
To correct the situation.
But then, be that as it may, we would try to meet them halfway and say, well, okay, give us a time when you think you can resolve this.
Okay.
But by human nature, some people really don't decide already they're not going to cooperate, but they're going to play the game.
Okay.
And so then you have that issue where you realize that they string you along.
Yeah, it gets dragged on.
Yeah, it gets dragged on. So then you have to do what you have to do.
Okay. All right. Well, I hope that, you know, as more people start to understand, because the question that just popped into mind now is that if somebody is not compliant with the law and you approach them, and then it becomes a public health hazard. Like, say for instance, a particular restaurant. If somebody gets sick from that restaurant, and then when we do the research, it's found out that they have been maybe cited quite a few times for certain violations of food hygiene. You know, are they liable now for that person getting sick, and then, you know, basically they can be sued?
That is a difficult one to prove.
Okay.
Reason being, if there is a complaint against a food establishment that someone was food poisoned, or a number of persons became ill after eating a meal, I guess you watch CSNI.
Yeah.
Right? and it takes a long investigation to prove that case. Because here's what we would have to do. Not only do we need to get the complaint from the individual, but we need to work with, if that person ends up in the emergency room in the hospital or even hospitalized, we need to get specimen of the food that they ate, and we need to get specimen of whether vomitus or whatever it is at the hospital, samples at the hospital, and confirm to see if what was in the food was in also those bodily fluids. Right? And very often, people either ate all the food or they throw away the food.
Yeah.
And so proving it.
You don't have the evidence to go off of.
Yeah.
Yeah.
Yeah. So it's just you can just come up with a theory that this is what it could have been.
Yeah. Okay.
Right. But the hospital could then say, all right, okay, they had such a case. This is what the disease was. And then what we would do is we would go to the food establishment, and even if the food establishment has leftovers, we can get samples.
Okay.
But your timing is important.
Yeah.
this must be reported very early so that you can get a sample of the food that is suspected of causing the illness. So time would also then play a role in terms of that.
A part of that.
But I think our best way to deal with that, we haven't had many complaints of foodborne illnesses. But one of the best ways to try and avert that would be education of the food handler, the food business operator, and even the public in terms of what to look for. And we have a constant program being run with food handlers with respect to proper handling of food, food temperatures, how to store food, and all that.
Okay, so let's get into that a bit, and then we'll take a break, because that's another thing that we hear announced on the bulletin board as far as the clinics that you run, as far as coming and getting a food handler's, I think it's a certificate or a license.
It's a food handler certificate.
Okay, so what's the process there, and how long is that certificate for? Is it an event per event basis, or is it I have to come back in every couple months to renew it, or how does it go?
There's more than one category. Now, in the food hygiene regulations, all food handlers are required to have a food handler certificate.
So who's a food handler? Let's start there.
A food handler would be one in the food industry who prepares food, who handles food.
Okay. So it doesn't necessarily have to be somebody, well, say they own a place, a restaurant, but you were talking about the workers.
You can own the establishment and don't prepare the food or don't require.
So it's those persons who have direct contact with the food.
Direct contact with the food.
Okay.
Okay. But it still would be good for the owner to have a food handler certificate, because if the owner is a very good chef, very good cook, and one of the staff doesn't show up,
they have to fill in.
They might want to fill in. It's a wise thing.
Okay.
For them to always be prepared and have at least a food handler certificate. And the process is, under the law, they're required to do a medical, and after the medical is done and all is well, they're healthy, because in that medical you are tested for parasites and tuberculosis and that type of stuff.
Okay.
And
basically contagious diseases.
Yes.
Okay.
Well, those are the mainly two. They do parasites and stuff. Okay. And once they have passed that examination, then they can get their food handler's certificate. However, a few years ago, we have deviated from the annual medical examination of food handlers, reason being, and this was a decision made higher up.
Okay.
It was based on research that was done, and it was done by the World Health Organization. And what the research showed is that educating the food handler gives better result in protecting individuals from acquiring infections than really giving a medical reason being. Someone could do the medical exam today and they showed no infection. But next week, they can become infected. You give them one for next year, and all along they're operating, and they're sick. So once you educate the food handler, and they operate in a manner which they were trained to do, then all would be well. The only problem is that when you educate food handlers, sometimes they don't adhere to the training, and that is the difficulty.
Because then the enforcement of that training is basically left to whoever the supervisor is of the establishment, and not necessarily environmental health division to be coming around all the time, checking?
Well, there are certain things that the environmental health officer would pick up
Okay.
when they visit the establishment.
Mm-hmm.
But the customers who visit the establishment also could be your eyes and ears.
Okay.
But the supervisor also needs to be up on the game in terms of what should be happening with respect to
food hygiene.
Food safety,
Okay.
so to speak,
Mm-hmm.
in terms of keeping the right temperatures for food, whether it's hot or cold holding,
Mm-hmm.
the way you sanitize your equipment,
Mm-hmm.
your cutting boards, how you have a prep sink, and you use that prep sink only for prepping food, or then you have your two utensil sink only for utensil, and also to ensure hand washing is very important in the food industry.
Okay.
If you're moving from one food to another, you're prepping food, you need to wash your hands. You need to have a hand wash station and a hand wash sink where the people who prepare food can wash their hands. There are some food handlers or people believe that once you have on gloves, it is okay, but you need to change those gloves frequently as well.
Yeah.
Because if you're moving from food to food,
Yeah.
you really shouldn't be touching too many food with the same
With the
glove,
same glove,
because it brings the same results as if you have a dirty hand.
Yeah. Yeah, because then you're transferring from one food to the next.
Yes.
Okay. All right. If you just tuned in tonight in the National Boardroom, we're talking about environmental health, and we have Mr. Carnel Smith from the Environmental Health Division, which is a division of the Ministry of Health and Social Development. And they're part of a team that basically keeps us safe. A lot of things we take for granted, like when we go and we go to a restaurant where we say grace and we get down to it, eat everything, and hope tomorrow we're good. But it's very good to know, though, that that we have some people moving behind the scenes, essentially, to make sure that we do have safe meals, not just a good meal, but a safe meal. We're going to take a quick commercial break, and when we come back, we're going to start to get more into environmental health and the career choice that's a possibility for all those high school graduates that are about to walk out on the streets. So we'll be right back with a break for more sponsors. Welcome back. You're tuned in to the Vigilate Dialogues. I am your host, Shaina Smith. And with me this evening in the National Boardroom is Mr. Carnel Smith, the Chief Environmental Health Officer. And we've been talking about the important work that the Environmental Health Division does in terms of keeping us safe, not just food safety or from mosquitoes. And we know rainy season is coming soon, so you guys are going to be coming around. But many other things, and we're going to start to get into that right now. So, Mrs. Smith, let's talk about areas of training in environmental health. Earlier you talked about, or you mentioned that it's a multidisciplinary field. And so there are many different areas that the officers basically can be trained in and cover, such as vector control, food safety we touched on, institutional hygiene. When we talk about institutional hygiene, what specifically is that?
Okay. Institutional hygiene relates to those institutions such as clinics, hospitals, daycare, preschools.
Okay. So what do you do there?
Prison.
You go in and inspect and make sure there's a code as far as certain things that they have to be doing or in adherence with?
Yeah, well, just remember that the flip side of institutional hygiene is similar to food safety or food premises, where it might have a kitchen.
Okay.
It has a waste disposal system. It also has occupants there, like if it's a prison, you have inmates.
Yeah.
And they are not always healthy.
Okay.
So infection could be transferred from one to the other based on the way they are arranged.
Okay.
If it's a daycare, you have kids there. They may have toys to play with. Infection could be, or disease or something could be passed through the plane of using toys.
Okay.
They touch each other. And so therefore, you go and you look at the whole arrangement of the care. You have a playground. You need that to be safe as well.
Okay.
So even if but a hospital then brings another aspect to it, where there's some you have sterilization and the clinics, sterilization of equipments. They too have a kitchen for their patients. You want to make sure that they're getting potable water.
Okay.
So all those things are a part of health.
Okay.
And in hospital arrangement, you know, sometimes there could be something called you acquire infection while you're in a hospital. You go to the hospital for treatment of one condition, but then you acquire something else while you're in a hospital, and that is referred to as a nosocomial infection.
Okay.
And sometimes if you have an infection control committee, you might have an officer who might be a part of that committee from the environmental health side of things to be on that committee.
So do you inspect on an annual basis, and then do you issue a certificate?
For food establishments, we inspect according to the law, but then I'll tell you about the institutions after that. For food establishment, according to the law, each food establishment should be licensed between January to December. It is not possible to inspect all establishments in the British Virgin Islands
have a lot.
between January to so what we do is we would license them. We have recently started to license them like a year from the date of inspection, and they pass inspection.
Okay.
And
So
we're given a license.
12 calendar months, basically.
12 calendar months.
Yeah.
12 months from the date
of inspection. Okay.
But not really 12 calendar months, but for the calendar year.
Well, yeah, not a calendar year, but definitely 12 months. Okay.
Yes. We don't have the same system for preschools, preschools and stuff like that. They are not yet regulated. We work in collaboration with, for the daycare preschool, with the Ministry of Education and Culture on those, but we don't issue a license or so forth to them. But they are required to have a business license in order to operate. And if we inspect and they are not up to the standard that we expect them to be, then they may not get their trade license renewed or even the first one issued to them. So we work in collaboration also with trade.
With trade department.
With trade department.
Okay, great. All right, so that's institutional hygiene. We talked about water quality. So you go out and you inspect the water plants, the bottling plants.
Yes, we do water quality at institutions as well as schools. Take samples to make sure that the water is of safe quality. We do chlorine residual testing on the public water supply at various checkpoints. This is to ensure that the level of chlorine that is in the water is sufficient to keep the water disinfected, and that you are getting a potable quality of water. So that is done throughout the communities, and to check to see what the chlorine levels are. We also go to the various water bottling plants and check them to make sure that they are distributing safe water as well.
Okay. Here's one that we don't hear much about, but it's there. Port health surveillance. What's that about?
Port health surveillance is a very huge area. It's a new initiative. There has been past efforts many years ago in order to get port health on stream. But I was taught about port health when I did my basics in environmental health. And that was many years ago. And port health deals with ensuring that persons visiting your territory is not coming with infectious disease that could be transmitted to your population.
Okay.
It also has the flip side, where anyone who is leaving your territory that may be sick and capable of transmitting an infectious disease may be required not to travel.
Okay.
So, and it entails us having to inspect all ships, whether it's cruise ship, cargo ships, or pleasure boats that make international voyage outside of the territory and return.
Yeah.
The program is still in the embryonic stages.
Okay. So this will require having an officer at the different ports, basically.
And huge resources.
Yeah.
The BVI, I won't sit here and tell you that the BVI can cover all the ports of entry. The port health is directed under the IHR, which is the International Health Regulations.
Okay.
They have been reviewed in 2005. They existed since the 1950s, and then they were reviewed again in 1969.
Okay.
And now they reviewed in 2005, and there were some changes to those regulations.
Okay.
First, before 2005, each ship required to have a DRAT certificate. But now that DRAT certificate has been changed to what is called a Ship Sanitation Exemption Control Certificate, or you can have a Ship Sanitation Control Certificate. And there's a difference in the two.
Okay.
Because you need to inspect a ship, and when you inspect the vessel, you inspect that vessel from stern to bow based on the type of ship it is.
Okay.
Because
whether it's a cargo ship or a passenger.
yes.
Okay.
Based on the amenities on that ship. And if that ship has any infractions on that ship, which poses a threat to whether the crew or the passengers, you have to bring attention to the captain or the mate or the company who owns that ship.
Okay.
Then you would have to issue a Ship Sanitation Control Certificate.
Okay.
So you give them some control measures.
Okay.
But if the ship passes the inspection, then you have to issue a Ship Sanitation Exemption.
Okay.
So they're exempt from control measures.
Okay.
And those certificates, a certificate of that nature lasts for 6 months.
Okay.
But we are not yet issuing those certificates. We are not yet fully into the port health program because it requires legislation which is currently being looked at.
Okay.
It's an area where the BVI can generate lots of revenue.
Okay.
Because those certificates would cost money.
Okay. So there would be a fee basically for them.
That would be a fee for conducting that inspection and issuing that certificate.
Okay.
So that might be a revenue earner for the territory.
Okay.
Whether the ship is a mega yacht that is visiting, or it's a cruise ship, or it's a ferry or yacht, whatever the vessel is.
Yeah.
So
that's basically all part of when we talk about border protection. It's not just limited to immigration and customs, but we have to be monitoring our health.
Yes, and
well.
we're not just only under port health. You're not just only dealing with disease threats, but you have terrorism.
Yeah.
And you have nuclear threats.
True. And
quite a lot. Yes, quite a lot of radionuclear waste and material is transported through these waters outside Anegada, going down the train, and suppose there's an accident.
Yeah.
It's huge.
Yeah.
It's a very big area.
Very. Hearing it explained now, I thought it was just going to be, well, I guess agriculture is more or less the same thing, but it's even then, that's on a wide scope too, because with the amount of international traffic, because basically that's what is in and out of here every day in the BVI, whether it's through recreational vessels, the ferries, the cruise ships, the airplanes. We have a lot of traffic that would have to be monitored.
And also the waste that the ships or vessels might generate, even at the port itself. There are other agencies, like you mentioned, agriculture. They might bring plants. Agriculture must do the necessary certificates and inspection of that as well. And there goes again revenue. And you can also look at the area where the importation of food, and we do a lot of importation of food, and food is only inspected here after it reaches the shelf. But under the port health program, containers would have to be inspected during the offload of the food. So it is something that is taking time to develop, but there's a deadline, and the deadline is already here.
As far as international requirements.
Yes. But we can ask for an extension, but the extension that you will be given doesn't mean that you're going to drag your feet.
It has to be even quicker turnaround.
You still have to meet that deadline. But I am comfortable in saying that the BVI has done very well in terms of trying to meet reach compliance with the IHR. We are still working on it. It's taking a little while because many agencies have to be involved. They might have legislation, but the legislation might be old and lack teeth. So those are the things that
as part of that modernization process now, that has to come up to speed.
And we can talk a lot more on that, because
that's another show.
At the port, you must have you must be able to show how you can respond to any event, whether it's disease, some nuclear radioactive activity. If one individual comes to the port, and this isn't only the seaport, it is at the airport as well. And you need to have somewhere where if there's a suspected ill or an ill patient traveling, until you can confirm that that person is not a threat to the population. Because remember, you have people at the front line at the airport and at the seaport, and they are at risk first. So you have to ensure that those persons are protected. So then you must have some place at the port where you must be able to do some examination or screening of a patient. Then if it is a whole plane now or a whole boat, then it's a whole different thing. But like I said earlier, we can't do this. We can't have all these amenities and all these standards meet at all the ports. So we have to develop a way in which we can satisfy all the criteria, but by not having all ports registered as a international port for travel.
And get a certification basically from the international regulators.
Yes, and I could say safely that definitely the airport needs to be one, and we need to have at least two of the seaports.
And that's, well, basically we have to choose, because then we have also just Van Dyke and Anegada to consider.
Yes, but then if you can set up, have the system with a mechanism where you can show that if there's the need to respond, you can respond. Then that would be all well and good. Because the BVI will never have sufficient resources in a short period to to do that.
Okay.
Okay.
Well, I think that's a good place to end. Believe it or not, our hour is up. If you just tuned in, you've missed our conversation about environmental health. And we've been talking with the Chief Environmental Health Officer, Mr. Carnel Smith, who has been enlightening us about what environmental health is and the important work that they do to keep us safe as a community. We're just talking at length about port health surveillance, which is one of the aspects that they're currently working on developing a program for, and also the need that to meet international requirements, essentially, as far as that goes. So let's wrap up on the note of, we were talking earlier before the show started, as far as I was asking the question, how did you get into environmental health? But we don't have time for the story. So as far as a career choice, talk briefly a bit about, I know one of the things that we were to touch on more was about specialization, and I guess port health would be a specialization under environmental health?
Yes, it would be.
Okay, what are some of the other specializations? And then we'll talk a little bit about the requirements to become an environmental health officer.
Well, to be quite candid, we haven't even scratched the surface
I don't think so.
of the areas for training in environmental health. But if you want to have me on your show again with respect to that, that can be done. But all the areas that were mentioned in terms of vector control, that could be a specialization. Food safety can be a specialization. Institutional and recreational hygiene could be a specialized area. Then we have communicable disease investigation, and you have water quality, wastewater, all those areas, occupational health and safety, solid waste management, all the areas. There is the way you can become specialized in those areas.
Okay.
And you can go on to become an epidemiologist.
So that's somebody who deals with diseases for a living, basically. Okay.
And you can go on to also be, let me give you, we have meat and other foods here as well, inspection. And
I think at one point we had also talked about, a briefing, things like working in the abattoir and doing inspection of different meats before the animal is killed, and then even afterwards, to make sure that that meat is safe to go for public consumption.
Yes.
Okay.
And you can become an entomologist, and that is one who study about all the various insects and stuff like that. One can become a civil engineer, or one specializes in wastewater management.
Okay.
And all the various areas that relates to environmental health, one can become specialized.
Okay.
But first you need to do the basic training.
Okay.
And move up the ladder as you go on to specialization.
Okay.
I became interested. I was introduced to environmental health shortly after I came out from high school. I had other interests, but I didn't pursue those interests. I pursued some job in other areas. Didn't get the job, and was told about being a public health inspector, because that's what they used to be called then.
Okay.
And then the name was changed to environmental health officer. And when I was introduced to the profession of public health inspection, I then asked the question what it entails. And I was introduced to someone who was in the profession.
Okay.
And I sat and discussed with them, and they told me what. I said, this sounds interesting. This is something that I could do for my life. And
he has a passion for it, trust me. I sat in that office an hour and I didn't even realize because I was like, wow, I didn't realize environmental health consisted of so much information.
Yeah, so I said, this is something I can do for the rest of my life.
Okay.
So I fell in love with it. And you must love what you do.
That is true.
And if you love what you do, you'll do it well.
Yeah.
So I chose it then, and I stuck with it.
Okay.
And it is something that I would sell to other people, but there weren't a lot of young Beefy Islanders who see it as a profession then. Reason why? Because it wasn't paying a very big salary.
Okay.
And it was in competition with people who it had the same basic requirements to go into an institution to study environmental health as it requires for studying medicine.
Okay.
So one said, well, Being a doctor is more prestigious.
Yeah, makes more money.
Makes more money, and I would want to do a doctorate and be an environmental health officer. But it's what you love doing.
Yeah.
And
it's just as important, I think, because just like you're talking about things like disease control, you know, it's I think prevention, as the old saying goes, an ounce of prevention is better than a pound of cure. So we might be easing the load a little bit on the doctor, but then that's a better thing because, you know, it's not everything we can cure.
Yes, because sometimes you could continue to treat, and I have great respect for the doctors.
Yeah,
many friends with doctors because we need them.
Yeah, we do.
Okay, you can't prevent every illness.
Yeah.
Because we are part of our environment. And you live, you breathe air, you drink water.
Yeah.
Your environment
impacts us every day.
Impacts you every day.
Ways, yeah.
But if we can control the environment, but human beings makes the difference in the environment. They change the environment by their activity.
Yeah.
And if you could get them to adopt on and to change some habits that would make a more healthy environment, then they'll be healthier. Because if we continue to have sick people in our community, then our productivity is low. And then you'll find that the burden of health care goes up. And then what happens to your economy? It's linked to the economy.
Yeah, I was about to say, because it will have an economic implication at some point.
Serious economic impact.
Yeah. So it really is important in terms of, you know, preserving that situation where we can be productive, everybody is healthy, especially with our economy based on services, you know, where we're providing services to people and people are coming in and out of our borders. So it's very key that we pay serious attention to our environment's health and what we need to do. But Mrs. Smith, we have to wrap up. I thank you for being here. You definitely have to come back again and talk some more about the career of environmental health. I think it's something that our science students or anybody, you know, as a matter of fact, can come in and talk to you. Go in and talk to him. And let him convince you about going out and being an epidemiologist. I don't know. It might be something you're interested in. So, Mr. Smith, thank you for being here with us this evening.
And thank you. It's been my pleasure being here with you. And I look forward to being with you on the show again.
Thank you. If you just tuned in, you just missed an excellent show here in our National Boardroom tonight about environmental health. My guest this evening was Mr. Carnel Smith, the Chief Environmental Health Officer. The Dialogues is shown here on Channel 51 CBN TV on Thursdays live at 9 p.m. and it re-airs on Sundays at 6 p.m. So you'll have to catch the show on Sunday. If you'd like to be a guest or a sponsor on our program, you can call us here at the studio at 494-7815. You can also log on and watch the live feed of the channel at www.cbnbvi.com. This is your host, Shaina Smith, saying let's continue the change in conversation for a better Virgin Islands. Good night.